Good morning, everyone, and thank you so much for joining us today for our COVID-19 and OSHA requirements webinar. My name is Casey Hope, and I am the Director of Marketing and Communications here at MedCom Benefit Solutions. And as always, I am joined today by Michelle Barki, our Senior Legal Counsel, who is going to take us through the steps today, some things that you guys should know, that employers should know as we are many people are starting to go back to the office, open back up, with reserves, being reserved about that and all, and being very careful, just some things that people may want to take into consideration as we begin to consider that. We'll let you know that this presentation is being recorded, and we will be able to supply you with that recording and the slide deck immediately following this webinar. We will also make it available, as we do with most of our webinars, on our YouTube channel. So if you aren't familiar with that, go ahead and subscribe to our YouTube channel. It's MedCom Benefit Solutions. And we usually post this kind of information on our LinkedIn page as well. So just know that this is being recorded, and we will be able to provide you with a copy of it after the webinar concludes today. So with that being said, I'm going to go ahead and turn it over to Michelle, and Michelle's going to take us through what we're going to be talking about today. Michelle Barki.
Thank you, Casey. And first off, when we first get started with this OSHA and the presentation as today, OSHA does have a general rule, which is you have to keep your workplaces safe and free of undue risks that employees may experience if they come to your workplace. When we talk about COVID and some of the hospitals and things like that, they have very rigid standards by OSHA as far as infectious disease control is concerned. But in the workplace, we never really have had standards. So we are looking at that general rule, and then we're adding to it and thinking about what could we do to make sure that we don't have an exposure in the workplace. And we're going to talk about potentially a workplace exposure risk assessment, appointing a COVID officer and having a preparedness plan. And then we need to have employee, contractor, and visitor procedures, employee training, and then always a contingency plan. So those are the areas that we're going to talk about today, and how we might really beef up our offices for COVID. And also, when you think about it, for all those infectious diseases that we get throughout the year, whether it be a flu or whether it be common colds. And as you've noticed, this year with all the COVID protections we have put in place throughout the United States, the incidence of flu has been way down. When we did expect to have a rampaging flu season this year, it just did not materialize. Not finished it yet, it can still happen. But I want to give you an overview of OSHA and some of the things that I think offices should take into consideration. First off, we know the pandemic is still going strong. We've got those different strains that are now coming in. As of Sunday, Florida was leading the nation in that on the strains that were not the original COVID strain, but the variants. And Florida was leading. Didn't have too many cases, but we still were leading California, who came in second. We also have a new administration with President Biden now taking office, and he has directed all the agencies to take a good look at COVID and what they might do to beef up the rules that they have in place. So we do expect that OSHA might come down with some further guidance for the general working population. And again, it's just good practice to make sure that we have a safe return to the office, and that we do follow some procedures and have that in place. Not only do we want to mitigate people getting sick, and we want to have a strong office policy, but we also believe that down the road, those litigations are going to start happening, and there will be lawyers out there who will think nothing of taking businesses to court if they don't think they've had a strong enough policy in place. And unless we put in place by federal law that, there's some kind of immunity that they were talking about, but they haven't done yet. So with that in mind, let's go ahead and get started, and some suggestions that we believe that are good suggestions. because basically what you want to do is, under that general OSHA rule, have a safe working environment. And it's all going to start with a risk assessment. What does your environment look like? And that risk assessment, like it is for HIPAA, should be thorough and accurate. One of the first things we always recommend that you do is maybe potentially hire an industrial hygienist. An industrial hygienist is a specialized person who actually has certificates in industrial hygienist. They have gone around to the restaurants, and they've gone around to various big businesses and manufacturing plants, and they managed to put together some pretty nifty reviews as to what is needed in your work environment. Now, one of the things that the CDC said right from the beginning is that the biggest issue with COVID is circulation. It's that ventilation. We know that it's airborne. That's why we're wearing our masks and we're social distancing. But if we don't have a good airflow, that's the issue. And one of the things with that airflow is that we know in most of our businesses, we can't do what the CDC wants us to do, which is open the windows and open the doors and keep that ventilation going. We can't, especially if you're in a high rise. You can't open those windows and they're locked solid. So there's other things that we can do. And one of that is you can do an air quality test and see where your air stands and what it looks like, what it's growing. An industrial hygienist can do this for you. And then, you know, at the bottom of that is take a look at your air conditioning systems. What are we doing with air conditioning? Do we have HEPVAC filters in place? And what about ultraviolet lights? So many things that we can do with the air itself. So that's one of the ways we want to always start to looking at this risk assessment, is take a look at the ventilation. And then maybe we need to do some upgrades to the office as well. Some of the upgrades to the office is we do have to make sure it's socially distanced. And a hygienist can help you with that as well. They'll do the measurements and they'll make recommendations as the best way to look at the office and the office flow, as well as they'll take a look at making sure that there are adequate barriers in place, so that if you were one of those wide open offices that believed in a wide open workspace, and now all of a sudden we've got COVID, barriers and cubicles with some kind of barrier might need to be established. Now, we know that we have all gotten very smart in the last year, and a lot of us are now working from home, and we do have those remote work capabilities. But eventually we might want to go back to the office. And, you know, the other factor to consider, just like it is with the schools, is the mental health of employees. There are certain employees that just are not thriving at home and they want to be back in the workplace. You know, Medcom, we were very, very surprised because early on, we were having some issues with depression, and the millennials in particular really wanted to get back into that work environment. And I thought, well, this is really strange. I would have thought that the millennials would be the ones that would thrive at home, and the older workers would be the ones that were raring to go back to work, but it didn't turn out to be the case. It was the millennials. And then SHRM actually did a survey, and they found the same thing. So as we consider returning to work, we've also got to consider who returns to work and who wants to return to work. And of course, we have to follow those CDC guidelines. We have to make sure that we are social distancing. We have to make sure that we do have enough hand sanitizers. And we do have to make sure that we have all the policies in place to make sure that we have a clean office environment, that things are wiped down. One of the things you might want to consider if your cleaning services does that is porter services, where they might come in twice a day and just wipe down the high touched areas. And that would eliminate some of the need of maybe your own employees wiping down high touched areas during the daytime. And then just making sure that all that is taken and documented. But you have to determine your vulnerabilities. What does your office look like? What does your air system look like? Are you one of those lucky ones whose office is a house so that you can't open the doors or windows? Or are you on that high rise that might need to take a look at the air quality and see what you do? But again, the first step is that risk assessment. And what I like about the industrial hygienists is that they will give you a thorough and accurate risk assessment. And then that is something that you can document, that you had an individual evaluation of your office and they made recommendations that you followed through on. And that gives you a lot of supporting documentation that you took this really seriously. The second thing that I always look at is maybe you have a HIPAA officer put in place, just like you would a privacy and security officer under HIPAA, that you have someone or team delegated just to do, to take care of all the COVID issues and to make sure that everything that you have put in place is actually being followed, and to have somebody that the individuals can go to if they have any COVID concerns. Now, the other thing that the COVID person would do, of course, is to make sure all the policies and procedures and education is being implemented and followed. Now, you should have an infectious disease plan. You know, hospitals have them. Anybody that deals with infectious disease has an infectious disease plan. But in the work environment, in a business office, we've never thought of that before, but we do have to do it now. So we would always start with the risk assessment, and then we would have to put into place after that some of the things that we are doing and how we're doing it. So consider the return to work plan. What is it going to look like? I'd always recommend you start small and work your way up. I would never recommend that you start with 100% of the workforce going back on a certain day and time and everybody shows up and then nobody knows what to do. So a return to work plan in stages is always the best way to do it, so that you can evaluate, make changes, and then continue on and improving your plan until you get it right. As we talked about, those environmental controls and cleaning are really, really important. All employees should have access to hand sanitizer. All employees should have access to various things where they can wash up their hands and everything like that. We have to make sure that masks are provided if people forget their own masks, and we have to make sure that we do social distancing. And keeping directional flow as going as well. We remember the Publix days when you know, you had the arrows going this way or the arrows going that way up and down the aisles. They have since removed them because they found that people were learning how to social distance, and we were all getting much, much better at that. So they thought the directionals were not as important. But if you have an office that have narrow hallways or narrow areas, you might want to consider putting directional flow so that people don't run into each other. And the same thing with your conference rooms, you know, what the maximums should be and things like that. And then consider other administrative policies and procedures for identifying those risks. But everything should be written down in a plan, and all this should be readily available to the employees. Now, one of the things that we also must do is determine who's at high risk. If they were to come back and they were to get COVID, who would be the high risk employees? And what can we do for reasonable accommodations under the Americans with Disabilities Act? And those are the ones that we really should be concerned about, and making sure that they work at home if all possible, if they can. Again, if we've been doing it for a year, a lot of us, we've been working from home. There should be those reasonable accommodations, if possible, to allow people who are at higher risk to continue to work at home. Or if not, what other accommodations can we provide? Now, employee, contractor, and visitors procedures. You know, one of the things that we would never have thought of 2 years ago is that we would be allowed to ask people about what signs and symptoms they're experiencing on any given day, and taking their temperature and all of this. That would violate the Americans with Disabilities Act. We would never have thought that we could do it. But because we are in a pandemic, we are allowed. So we should always make sure that somebody who's walking into our building does not have any signs and symptoms of COVID. And we can also make sure that they haven't come in contact with somebody who's had COVID during the past 14 days. The other thing the ADA allows us to do now also, and the government is allowing us to do, is even to ask about vacation plans and whether or not they've left the state, whether they've been to large gatherings, etc. So that every day, potentially, MedCom, we do it through an app. Anybody who goes into the office, we have an app that we complete that asks all those questions. And if you complete the app and you answer the questions and you don't have any risk exposures, we get a big welcome sign. You can come into MedCom now. But if not, we're totally telling the individuals that they have to stay home. Now, temperatures, at the beginning, everybody was taking everybody's temperature every day, and it's not a bad idea. The CDC has said more recently that it really isn't the best control it's an added control, but it's not the best indicator. So they said that you don't have to take temperatures. They still give us the right to take temperatures. So that would be something, depending on how hard it is to do it, whether or not you would want to continue to take the temperature of individuals. And again, can't stress it enough, hand sanitizing stations, disposable masks, and cleaning products should be made available. Now, when you look at the cleaning products, you should always make sure that your cleaning staff or the products that you have are effective against COVID. There are some approved COVID-related products that are available at the EPA website, and they tell you which ones are effective against COVID and which ones are not. So I would always make sure that you have that. And at the same time, the same holds true for sanitizers. It should have a percentage of alcohol or ethanol in it in order to be effective against COVID. So I would always make sure that you stress what products you're going to use and you stress what sanitizers you're going to use and have them readily available. And then also have the material data safety sheets available. For those who are not aware, every product that is developed does have a material data safety sheet attached to it, which basically tells you what to do in case of exposure, what the risks are, what's in the product. And if you're in an environment that you're using any product, it should be readily available to the employee on their website. And you can also make that a condition of the infectious disease control plan as well. Now, employee training is all important. You can write the best plans in the world. You can have all the hand sanitizers available. You can make the best laid plans of mice and men. But if you don't communicate it to the employee, you've done absolutely nothing. So employee training is all important. Before that employee takes a foot into that workplace, they should be aware of what the expectations are. They should know what the policies and procedures are. They should know where the hand sanitizing stations are. They should know which the directionals are going. They should know everything about that when they walk in that door. And then also with that, what to do if you feel sick. If they get sick at work, what must you do? And you know, one of the things that MedCom said right from the get-go is that if you start to feel sick at work, we don't require you to wear your mask if you're in your own location, in your cubicle or in your office. Once you get up in the common areas, you have to wear a mask. So we told them if they feel sick at work, they are immediately to put on their mask and walk out the door. Don't talk to anybody. Don't let your supervisor know. Just walk out and then phone and let us know that you're sick, so that you don't go around talking to all the other employees and potentially spreading the virus. And then you also, just like in HIPAA, you have to have a sanction policy. What happens if they don't comply? You know, at the beginning, it's very, very difficult. I mean, people forget. I mean, COVID was new and these procedures are new when you first come back to the workplace. But if you're intentionally disregarding these standards and these policies that are put in place for a reason, what do? So you've got to have a sanction policy in place as well. Now, the contingency plan, you know, HIPAA always says we have to have a contingency plan, right? To make sure that our systems are secure and that they're not only do we protect the confidentiality, but we protect the integrity, and we also make sure that things are available. And that's what we're doing when we're looking at COVID for this year. And, you know, we don't know what other pandemics might come down the pike. So we always want to plan ahead and think of the possible exposure. And what do you do if somebody comes in and all of a sudden they have COVID and they come into the work office? How do you mitigate that? And again, if you have a good infectious control plan, you've got the social distancing, you've got the good hand sanitizers, you make everybody wear masks. That's the beginning of that mitigation. But what are the next steps to take? And one of the things that OSHA says is that you do have a duty to report to OSHA if you've had an exposure at work. It doesn't mean you have to report if somebody got sick outside of work, but once you've got a work-related sickness where somebody got sick because of the office, then you've got to notify OSHA as well. And then what about an office closure plan? If you're beginning to get people sick and it's been spreading around the office, what do? You might have to shut the office down again. You might have to go back to earlier days where everybody is working at home. And then you might want to do a really deep cleaning before you bring everybody back. And again, if you open an office in stages, it's much easier to control than if you bring everybody back all at once. So one of the things that we always want to talk about is do not rush back into the office without a plan. Make sure you have a plan in place. Make sure that your infectious disease plan is already in place before you bring employees back. Make sure you have a risk assessment in place before you bring employees back. And consider returning in stages. Different phases have different people. And when you do consider working in stages, potentially you ask for volunteers to begin with. Who wants to come back to the office? Let me tell you, when we opened up the office and we asked for volunteers, our millennials were the first ones to say, yes, I want to come back. And then when you want to really start having a mandatory return to the office without just the volunteers, considering staggering that as well so that not everybody comes back at the same time. My neighbors work for a huge company, a railroad, which will go unnamed. And they said that when they started to return to work, it was first on a voluntary basis as well. And then each department, when they started to mandate it, had to have at least 33% of the people there. They have never gone up above 33%. So again, think about who should return to work, what it looks like, and be flexible and thoughtful. Nothing should be written in stone as to like this person has to come to the office and stay in the office even if everything else is going wrong. We have to be flexible. We have to look at those contingency plans and know that things may go backwards before they get completely better. So be thoughtful and be flexible. And the priority should always be safety first. Safety for the employees, safety for the vendors, and safety for the clients. That should always be top priority. And the other thing that we should always consider is if we do not have to have client facing in an office, then we should do it still on Zoom or whatever product you're using. But if you're a store or a restaurant, of course, you have to bring back the clients in order to do your business. And in Florida, I know that we're wide open. So, but again, safety of the employees should always be first. So start with a risk management plan and then go from there. Does anyone have any questions or thoughts or suggestions?
Absolutely, Michelle, and thank you so much for that really thorough explanation and suggestions. I know some of the things that Michelle and our team at MedCom have worked on have certainly made me and my team feel very safe. So these are a lot of great ideas to kind of talk about with your teams and implement along as you're starting to consider returning. If you guys have any questions for Michelle at this time, please put those in the questions panel. We'll be happy to address those before we dismiss for today. One thing that I did want to go ahead and cover with you guys are some of the upcoming webinars that we have for the rest of the month in February. Don't forget, if you are a broker who is looking for some compliance help, we always have our broker-focused compliance recharges on Wednesdays at 3 p.m. with Derek Ashton. And actually, Michelle will be his guest next week when they talk about ACA measurement periods. And then on Thursday next week, I will be working with our compliance department, Mary Catherine Waldron and Candace Jones, about the basics of 5500s, as 5500 season is upon us shortly. And then, of course, we'll round out February with another compliance recharge, the history of compliance. You can also find the Pandemic and COBRA webinar that we did a couple of weeks ago on demand. It's via our LinkedIn page, or as I mentioned before, you can go to YouTube and find that. Just subscribe so you make sure you get all of the updates that we have as far as our videos and educational webinars go. And don't forget, we do some other things here at MedCom. We do offer a lot of services for ACA employer reporting and penalty appeal support. We do consumer-driven health plan and COBRA premium billing administration. So if you want to talk about retiree billing and COBRA billing, flexible spending accounts, dependent care, that kind of thing, we have you covered, as well as HIPAA, privacy and security solutions, and health and welfare compliance and actuarial solutions. So we kind of cover a little bit of everything here. Michelle, we do have a question that has come in. It says, does MedCom have a sample risk management plan that we would be able to share?
You know, all risk management plans are kind of individualized per the organization, but we could certainly put together some kind of template, yes, that we could share out with common people, with everybody. So we'll try to get that ready for you for next week.
That sounds great. I don't have any other questions that have come in. I just want to say once again, this has been recorded, and we will be able to provide you with the recording and the slide deck immediately after this webinar. And we just want to thank you again for taking some time and putting your trust in MedCom and turning to us when you have questions. If you need to follow up with anything, if you have a question after we dismiss today, please feel free to reach out to Michelle or visit our website. We have a lot of information there that is incredibly helpful. So thank you, Michelle, and thank you, everyone. And we certainly hope you have a wonderful rest of your Thursday.
Thank you, Casey.